therapy. Another important thing that needs to be kept in mind is water. So water, otherwise also you have to take water, a good amount of water, because during radiation therapy also you may have some amount of weakness, and a lot of drugs when you're taking chemotherapy, a lot of apart from chemotherapy also there'll be some supportive drugs such as vomiting or some antibiotics, some painkillers. So it is very important to stay hydrated. You need to have at least 2 to 3 liters of water in a day. Good, you kept in mind. Another thing is because cancer itself can cause some muscle loss. So some amount of protein or protein rich diet, not extremely rich in protein, but a little bit of protein rich diet is better. But at the end of the day, it all depends on what is your cuisine and what are your choices. So you cannot drastically shift. For example, if you are a vegetarian, you cannot uh, become a non-vegetarian just because for the radiation therapy to get some amount of protein. You can follow whatever diet you are. And one more thing is there is no restriction in taking veg or non-veg food. Just make sure that it is not too hard. It should be boiled correctly, because when we give radiation, say to the pelvis or the stomach area, there may be temporarily some difficulty in digestion. So it is always better that even if you take meat or eggs or whatever, it is well cooked. And also try to avoid very hot or very cold food, because take it can irritate your throat, especially when you're getting radiation therapy for the head and neck region. If you're getting radiation therapy for any other region apart from head and neck, such as pelvis or say foot or say hand, legs, anywhere, then there is no much difference, because there you can take any food that you like. So these are all the some of the dietary not restrictions, some suggestions that I would tell you to follow. Another thing is whenever you are in consultation with your oncologist, they will generally include a dietitian also in your treatment follow-ups. So even if they are not included, you can always visit a dietitian for that 1 2 months. How we can go about it. So you need not worry that there has to be some drastic changes in your diet. Whatever you have been following with minor modifications, temporary modifications, can still continue to have your diet as it is. So that is all about diet in radiation therapy.